Just make sure that everybody can hear me, right? Good. So it's 3 o'clock. We are opening the room for everybody to join. My guests are already lined up here. I'm very happy. And we usually, I go on talking a little bit so that people can join us. Usually people join for for the first 5 minutes or so. So I take this time to thank everyone for being here. I will thank again later on. I begin to see some usual faces. I am so happy. Um, so this is this is a difficult day. But we are going to be tackling all the many issues that we think we all have in our minds today. But I wanted this to be, in many ways, a continuation of what we have been doing for the past 12 weeks. Today is week number 12. It feels almost unbelievable that we have been secluded in our places, living online for long, 12 weeks now. And of course, I mean, some of us started, the week before or 2 weeks before that. So just acknowledging that we are going through a historic, particularly difficult moment. And I have been reminded many times over the past couple of weeks, that everybody feels that they are living through a historic moment, and everybody likes to say, oh, this is the generation that's going to be X, Y, or Z. I'm not saying anything like that. I'm just simply acknowledging that it's been very hard to be going through those past few months. And one of the things that has helped me so much is to be here with you all each one of those weeks. So I want to thank you for that. We have a very nice group of guests today. I have put their names on the chat box, as I always do. They will, of course, be introducing themselves when they come on. And today we are going to be focusing very specifically on substance use and misuse in terms of both prevention and treatment. So I'm asking my guests to be thinking about what it is that they are going to talk about in terms of prevention and also in terms of treatment, because we need to think about those two things, right? There is no formula here in terms of what it is that I'm going to be asking you guys. All I'm doing here is facilitating a nice conversation between and across people who come in with some expertise in the subject matter. I want you to be thinking about clients. I want you to be thinking about research participants, and thinking about yourselves, and thinking about our friends and family, and all of those that we know who may be suffering from addiction at this point. And I can imagine how difficult it is depending on the kind of addiction and how severe it may be. What it means to be in the situation that we are and still having to deal with this enormous thing in your life, right? And sometimes, how can you prevent it? How can you prevent your children from having access to some substances that you don't want them to have access to? How about being someone in pain and unable to get your prescription pain medication? How about being someone who has been on medication and for some reason you cannot access it because the place where you get it may be closed? There are many issues I think we need to be thinking about as we do this. So I am asking you to help me do so. I was just reading an article in the Huffington Post, and I'm just gonna place it in here for you guys to see what I'm talking about. So this and then I'm gonna shut up and I'm gonna ask my guests to to talk. So there you go. It's by Carolina Abuelo. It's she's an MD in Massachusetts, and she says, I'm a doctor and I'm losing patients to a deadly side effect of the pandemic. So she goes on to talk about, like, not that she's losing her clients to COVID, but she's losing them to the addiction that they had before COVID came about, for a number of reasons that I hope that we are going to be talking about. I encourage everyone to go to the chat box and ask questions. to let me know if they would like to say something. Otherwise, I'm just going to keep going back to my guests because they have a lot to tell us. And the last thing that I will say, well, last thing for the moment, is that um, we have a situation in the country today that we cannot ignore. And I think that I don't want this to become about that situation, but I am asking my fellow colleagues and friends to touch upon those issues as we move forward with the conversation that relates to COVID and substance use and abuse. We know for sure that it is all connected. The epidemic of substances that we have in the country is directly connected to the violence that we see against Black people, against Latinx people. There's always connections that I can make, but I'm going to be asking you to make them for me. And so I just want to also acknowledge that this is an event that is put together by the Faculty Allies for Diversity. I am a member of that group and I am a co-chair of that group. Eddie Weaver, who usually is here by now, is my co-chair. And the other members of the committee are Lorraine Gutierrez, Todd Horan-Call, David Cordova, and Trina Shanks. I don't think I'm forgetting anybody, I hope. And so before we go into the today's session, and so my first question to my guests, so that you know and you can begin to think about, is just to think about the populations you work with and what's going on for them today. And when I say today, it's not only in terms of whatever addiction that they may have, with the compelling and compounding fact that we are living today under very difficult circumstances, stemming from the enormous violence that we have seen in the past few days in Ypsilanti, in Minneapolis, in Florida. I mean, we can go on, right? I mean, those are just the latest events. And before we do that, so I'm just gonna, already tell you that I am going to be starting with Lisa when we start the conversation. Lisa Gaskin, and she's going to be introducing herself when we start. And I'm going to start with Lisa because she a few weeks ago talked about people in 12-step programs, and I was really touched by when she brought it up. We were not having a conversation about this, and I want her to start, with that. But before we do, I would like to invite all of us to stop for a moment of silence, not only today for those we have lost to COVID, those who may be suffering from the symptoms of COVID, but I want to particularly for us to think about George Floyd as one. I can't say the names of all the other people who have suffered tremendous violence for the past many days, but let's concentrate, for the moment, and think about his family in those last moments, what they might have been about. And I invite us to think about as we move forward today. So just, a moment of silence, please. Okay, everyone. Let's come back slowly, and thank you so much for joining me in this moment. So I would like to ask Lisa if she can go back a couple of weeks when she was, joined us, and she talked about 12-step programs. And it doesn't have to be about that, Lisa. Just tell us who you are, your name, where you're joining us from, and just let us know what's, on your mind today.
Hello, everyone. I hope everybody is well. My name is Lisa Gaskins. I'm a longtime resident of the North community. I'm also a member of the North Community Collaborative Board. Also work in North at Integrity Women's Halfway House. I'm a counselor there. And as Rogerio was stating, our clients at 3.1 level of care have access to 12-step meetings through Zoom. Unfortunately, the ones at long-term residential and short-term residential who do not have telephones because of the level of care, and H&I, which stands for hospital and institutions, which bring a meeting inside of the facility, are unable to come. So they're affected in a lot of ways. A lot of our clients suffer from mental health disorders, anxiety, and depression. And this added on to what's going on with the COVID is really extremely challenging to keep clients in treatment. The 12-step groups that they're doing now on Zoom is challenging because a lot of them are used to going out to meetings and socializing. And it's really taking effect on our clients who are work ready and who worked at the time before this happened, were able to go out to save money so that they can secure their housing goals and become independent and productive members of society. That has been affected because due to them not being able to work, we're being tested, which is a good thing, every 2 weeks. And fortunately, we do have a place when a client test is positive that we can quarantine them at. So that's a good thing. However, in the North community where I live, walking around every day, and people who are still in active addiction is finding it hard to get into treatment. They have no resources, and a lot of times they have no telephones. So they're not able to link themselves to that support of 12-step meetings, which is very crucial for people who suffer from addiction to have that support network, you know. So those are some of the things that we're facing at this time at Integrity House and all over. And I think that a community has come together, and they donated like masks. We have gloves. We're being tested, but at some places that's not the case, you know. So it's very a tough time now, prevention, and what happens to those who want detox, and where do they go from detox, because we weren't allowing any new clients at the time, only clients that was in there and could be transferred from one level of care within the agency, but we weren't taking anyone in. So, you know, that's another, dilemma.
Lisa, I have a quick question. You've said so many things that I think we need to, tease out even further than what you already did. But I'm thinking about, like, imagining a 12-step program meeting, right? Where one of the major concepts is, you're true to yourself. You share who you are, sometimes very deeply. And that's part of what helps people in 12 steps programs. And even if you are not on a 12-step program and you're having like a group related work in rehab or any other place, the very idea is that you're seeing people, right? I mean, and you're together. It's a social activity. And it seems to me that what we have to do is the opposite of that, right? I mean, it's like we're hiding our face. So you're not quite necessarily as transparent because, physically you're not 100% there, which is one of the requirements for sobriety in some ways. And not only that, I mean, the voice is no longer the same because it's muffled, right? I mean, it does make a difference.
Yes.
And not only that, I mean, I think it changes completely, the social piece of the whole equation. And I want to, Lisa, to react to what I just said to her, and then I'm going to go to Phil, who also is a counselor, and I want you to reflect back on what, Lisa said before and what you may respond now. Okay, Lisa, so
So,
react.
so yes, it is very different because, like you said, on the Zoom meeting, I don't have to, a person do not have to show their face. I'm in recovery. Also, this July will be 14 years. God willing that I'll be clean from substance. And I find it difficult because I'm a meter maker, because, you know, that support group has helped many addicts stay clean. And when you talk about the sociability piece, like, I like hugs and I like to engage that sociability there. I like to go up to another woman in recovery and get her phone number after hearing her share, and build my support network like that. It's very different over the phone, because I'm calling in places that I don't know, you know, the individuals per se. There are people from all over. And like you said, you don't have to show your face. And a lot of people don't want to show their face out of anonymity, which is the spiritual part of it. And so it's very different, you know, and a lot of times the newcomer, which is the most important person at any meeting, they don't get that love or the people, their predecessors that came before them in the meetings to kind of reach out to them. It's not the same for them to keep them coming back process. So that's another challenging thing with, you know, with someone with years of clean time, such as myself. I have the coping skills, but when early on in recovery, it's easy for a person to relapse just based upon them not being able to go to that meeting, to walk to that meeting, you know.
So Lisa, thank you so much, and thank you for sharing a personal story with us as well. I just will make a comment, and I'm gonna give the mic to Phil. I was thinking, you know, like that the phone has been such an icon in 12 steps programs as the thing that you use to keep, you know, connecting to people beyond the meetings, right? But the phone is secondary. It's not the thing that you use. I mean, the phone comes after the meeting, where you call people to keep in touch, or sponsor it, and so on and so forth. So what you said, it just brings up that, you know, like how this whole COVID thing actually like reverses things, and it shifts things, it makes things upside down, where now the telephone and this is the medium. And seeing each other in person is not even secondary, because it's not necessarily something that we can do the way we used to. So thank you again. Phil, make sure to introduce yourself before you share your opinions with us and your feelings.
Hey, my name is Phil. I'm a mental health and substance use therapist at Easter Seals. And I think this entire process is not very like consistent when we look at like the client care. So like we've been doing telehealth services for around like almost 3 months now, and our engagement numbers have gone up, but the amount of like crisis clients have been in is also very much increased. So like, for example, like a lot of comorbid conditions, I've had clients that are like in a lot of pain. They have like fibromyalgia, they have lupus, they have MS, and they would normally be able to go to their doctor and get supplemental medications to help with that. But due to the fact that they can't go into the office due to COVID and the exposure that they could get based on that, they've had to find other ways to cope. So the relapse rate is so high. Like I've had a lot of clients that are like, well, I know I can drink alcohol or I can go and do heroin and it'll help alleviate the pain. I want to stay sober and I want to do the means that I was doing when the offices were open, and I did not have plans to go in relapse, but I cannot stand the pain that I'm going through right now. And then on the other end of the spectrum, you'll have clients that are like, they weren't engaged. We were about to close their case and we were outreaching them. And then we were able to connect with them and be more of a support than we would have been if it was still in office services. So it's kind of like interesting, as well as kind of leading off of the AA. Like we run substance use groups at our agency as well. And it was a very successful group up until like COVID started, and we tried doing it on the telehealth way, because I experienced something I thought I would never experience as a substance use therapist, like because we were doing it and people, now that they're on their phones, they can be anywhere. So somebody actually in group was feeling triggered and they admitted like, hey, I'm about to buy drugs. So they were in the process of buying drugs while in the group, and we were trying to like facilitate the discussion, and then they subsequently like left the meeting. So now the resolve that you would normally have, like, okay, we've de-escalated this person and we have a plan, we weren't able to connect with them afterwards. So it's like, as a mental health and substance use therapist, as well as a participant in the group, it was like, what do you do? Like, normally you wouldn't have somebody in the office trying to use substances at the time. And if they were, you would have some type of plan. So I guess it's very interesting, as well as now we're able to do like telephone sessions and telehealth sessions. But the big question is, are insurance companies going to continue that into post like government assistance, as well as is the technology? Because I'm able to do telephone sessions with people right now and they're not required to go on a program. But if the funding does not cover phone sessions, the lack of accessibility for vulnerable populations to get a cell phone or to have internet or have an iPad, like our agency were able to secure funds to get it, but we were only able to purchase 50 iPads. How many clients are we going to be able to reach with the 50 iPads? Only 50 people. So, and how are we going to delegate that? So I think it's a barrier based on people's different social identities and social means, as well as financial means of, am I able to do this? And am I going to be able to sustain the services that I've got? And how disproportionate it would be if we were able to do a session and services for people for a short period of time and then leave them into a destitute afterwards. So these are just questions that are looming of like, how as a professional, can you help somebody when the means and ways they're getting services may not get covered in the future? So
this is great, Phil, because you brought up a structural issue, right? I mean, which is, when the client is already in front of you, the treatment itself or the discussion, the conversation you're having with the person, in that moment, we can even, pretend that we can actually isolate that moment from everything else that's going around. The person is already in front of you. But what you're bringing up is all the structural issues. One, that brought the person in front of you to start with, right? I mean, all the social determinants of health, and in this particular case, the social determinants of addiction, right? Who is more likely to become addicted, and who is more likely to become addicted to what, and who is more likely to become addicted, use whatever substance that they might be addicted to, and stay on that addiction for their entire lives, because they can continue to buy whatever the product is. They can continue not to be put in jail because they may have some social characteristics that allow them. And I'm not saying that this is healthy, but there is a way that addiction can be almost permanent in some people's lives, and really not get to a point where it is so disruptive that they have to stop it. But sometimes structurally, addictions are stopped structurally because individuals are caught into a web of police, in transit, social services, and all the other things that we know about. Parents who probably would not be caught otherwise, but they are caught because they may have behaved, abusively toward the child. So not only they have now to answer to the abuse charge, but they may be found to have an addiction, and then they lose the right to actually keep the child, right? So, and I can go on and on, because it seems to me that this thing just keeps like, it's like a mushroom cloud. But you brought it up, so I want to give it back to you a little bit, and then I'm going to go to Cristina and ask her to comment upon these things, and perhaps not only the environmental pieces, but also if Cristina can comment on the genetic pieces that we know about, that that come together, bringing all making some people more or less likely to become addicted. So Phil, do you want to make a comment on that?
Yeah, so I think additional like systems that I didn't even allude to is people's like financial situations. Like unemployment is like darn near impossible to navigate, let alone if you don't have the means and knowledge and accessibility to be able to do so. So it's also like a compounding thing of that, as well as if people aren't able to access the services, we're not able to effectively like treat and help assist where we otherwise would. And courts aren't really open right now. So people may have received a charge, but now they're not getting sentenced and they're not having their behaviors like regulated or even mitigated in the moment. So it's like kind of a disproportionate thing of like, are we addressing it? And if how we're addressing it, is it adequately assisting in the moment or actually hurting? Because I have a couple of clients that are like, yo, I'm so worried about this pending court case that I have relapse now, which could compound and make my situation even worse. And it's like, if the systems were operating in a way that were able to assist at the time, it may have mitigated more damage in the future.
Mm-hmm. Thank you so much, Phil. I'm going to give it to Cristina to talk to us. And Cristina, make sure to tell us who you are.
Yeah. Hi, everybody. I am joining from Michigan. I'm a faculty member at the School of Social Work at the University of Michigan. And my research looks at substance use initiation and progression. And as Rogerio might have alluded, my work looks at gene-environment interaction. And so the thing that I focus on particularly that has this strong link to what we're all experiencing currently with the shelter-in-place orders are the increases in anxiety and depression that act as stress and risk factors for using substances. In terms of sort of the gene and environment piece, what is really important and an area also of my work is the role that stress plays in creating vulnerabilities, in expressing vulnerabilities that we may all be walking around with, but have up until March 13th or so had under control because we had access to resources, we had access to social support. Now in this environment where we are all either worried about our own health, the health of our family members, we might be worried about finances and loss of jobs, those stressors might be bringing about vulnerabilities that now, compounding everything, we may not have the appropriate services to manage. It sounds like from the previous speakers, if an individual was already currently involved in receiving some services that, there's alternatives. I have been particularly thinking about individuals who during this time do resort to using substances as a way of coping. And in a small sort of anecdotal and very non-scientific example, if you're on social media, you have probably been seeing all of these memes regarding, substance use or drinking during the day, these new behaviors that there are fewer people now letting us know that
everybody's eating a lot of sugar
and
all
baking,
the time,
right? Yes, we bake every chance we get. So yes, exactly. So there are newer stressors that are compounding some of these vulnerabilities that would have otherwise been managed, that we would have gone to a friend, to deal with a stressor. Now, maybe we might be able to touch base with them in an environment like this. But if not, if there's no one there saying, you're really going to have a second glass of wine or you're going to have a beer at, whatever time, we don't necessarily have access to that. So it's creating this huge public health unmet need in terms of services for individuals that might escalate as soon as they initiate. And so my work also looks at adolescent substance use. And while adolescents and young adults are maybe not interacting with their peers currently if they're at home, I think there's a couple other risk factors in there as well. They might be at home witnessing substance use within their families, how parents might be modeling those behaviors, and so they may be learning new maladaptive ways of coping. But if they're isolated and have really no access to social support, that creates another important vulnerability. Certain types of substance use is the ones like tobacco, electronic cigarettes, and marijuana are particularly important currently because those decrease our respiratory function and may create additional risk factors for the effect of COVID, for developing the illness and developing a worse prognosis. So those are some of the things that we've been thinking about in terms of how COVID is sort of changing the substance use landscape for prevention and sort of the initiation, a time that's so important to make sure we have services there to intervene.
So Christina, I will make a comment and give it to you, and I'm just preparing Darris that I'm going to be going to you. I think that our first three guests basically gave us a very nice landscape of the basics that we need to be thinking about, right? What may be exacerbating former addictions, people who may be initiating now, the difficulties of preventing people from picking up at when they may have been sober for a long time. So we laid out and we pointed at the idea that there might be a genetic piece that makes some of us more or less likely to to addictions, and also of course the many social determinants of health, which I would like for us to begin to concentrate on as we move into the second portion of this event, which is, I think that everything that we talked about is true. I just don't think that they are necessarily equal for everyone, right? And so, and I would like for us to, as we move to the next half of the program, to concentrate on that. And so I'm going to be asking Darris to comment on a few things he brought up a few weeks ago when he was here as well, in terms of vulnerabilities to the actual infection of COVID, and how that plays out in terms of addiction and perhaps the type of substance that one uses, because I don't think that people behave the same if they are addicted to different types of substances. As we all know, especially adolescents, are more likely to become addicted to more than one substance. Some substance leads to the next one. But what I would like for, before Darris comes on, for Cristina to comment on, it really brought home, because we talked about a couple of weeks ago, or maybe it was last week, I'm lost, about young people. And I believe it was Todd Horenkall who commented on the fact that, instances of child abuse and neglect has been going down. The reports of it are going down. But the what makes it very perverse, it's not that a child abuse and neglect is going down. On the contrary, people believe that it's actually going up because of the, being in the house with the abusive parents or the abusive partner or whomever that person may be. But it is because, social workers and other professionals are not there to witness the abuse and the neglect. But we did not touch upon the idea that if you are abusing drugs or even using drugs in ways that are different now, where we don't know the social norms anymore, right? It's like, I'm going to have a glass of wine at 2 o'clock in the afternoon. Well, normally that may not be a problem, but because we don't know how to socialize that way, that is changing as well. And I wonder if you can comment on the idea that the use of substances may in some ways exacerbate abuse and neglect of children.
Right, absolutely. I think that considering that we're not, encouraged to travel far from our homes, we're all sort of at home, so people may be drinking higher, earlier, for longer periods during the day, and engaging in bad parenting. I mean, I think that an additional stressor that I didn't mention earlier, but I think that is relevant as a risk factor also to engaging in abuse and neglect, might be sort of the stress of having to school the kids at home and manage math and manage running into being the lunch lady for like a little bit of time, right? So all these multiple roles that parents are asked to perform, in addition to making sure that there's food on the table. So I think that's a very likely scenario that bad parenting, bad monitoring, bad discipline is only going to come out of our inability of knowing how to properly use substances, if at all, to cope with this difficult time. I think that it might be, you know, children being on electronic devices a little, you know, early in the day and for a long time, while parents just go in a different room and try to decompress. So I think that's just a dangerous, you know, situation that if we don't have the social workers there witnessing, or there are fewer people calling for whatever reason, I think that's a real issue that we need to be aware of.
It seems to me, though, so I'm going to you, Darris, in 2 seconds. I have heard many times, you know, from friends and read about this. I think COVID asked parents to do things that many of them are more than happy to do, which is to, you know, teach the kids, you know, like all the things that Cristina just shared with us. The problem is that a lot of people that I have heard from are feeling inadequate. They are not feeling that they were prepared to do it. And there's a lot of self-judgment. And I think that that is in many ways the kinds of things that are contributing, you know, to make people perhaps, you know, change their behavior and even begin to use substances in ways that they didn't before, because there is a disconnect between being asked to do something, having the intention of doing them well, and feeling that they are failing over and over again. And I can just, you know, I'm a witness of the countless times that I have been in meetings like this, which God knows how many I have been, or with friends. And then a kid comes along either from the back or to the side, and they're rejecting that the children may be feeling every single time that they come around, and the parent has to tell them, go to the other room. Or the parent has to, you know, this is the important meeting. This is not for children, right? So I think that parents are also feeling inadequate in that sense, and being very, you know, being in a situation where it's sometimes unnatural to be so rejecting of the company of your own offspring. So I just thought I'd say that. Thank you so much, Cristina. And I'm gonna go to Darris, you know, with my old question about all these things are structural, right? I mean, we are not affected the same way by all the things that we are talking about. So what can you talk to us about today, Darris, about how you are today, but also how things are going in Newark and around you? You need to.
Okay, I got it. Yeah, good afternoon, everyone. My name is Darris Hawkins. I'm a harm reduction specialist at the Crossroads over in Newark at NJCRI. So much was said, and I have so many things that I want to get out really fast. But when you talk about the children, homeschooling the children, the teachers, oh, I appreciate the teachers so much. I never knew how hard it was to try to get a kid to do something, unless it's Fortnite or one of their games or something. But that is so hard, and I just commend all teachers all around the world. They deserve whatever they should get, whatever. You know what I mean? Because they're doing a fantastic job. I didn't realize how hard it was, so I had to do it myself. No, I'm not even doing it. I'm watching her do it, and she's struggling, but she's doing a fantastic job. Now, when it comes to like I'm a recovering addict or whatever you want to call it. I was on drugs most of my life. I didn't get off of drugs till I was 46. I started when I was maybe 12 or 13 years old. From 13 all the way up to 46, I've been in and out of prison doing a lot of stupid stuff. But I was affected with the COVID. I had it. I dealt with it. I went through it. But since the COVID has been going on, I had 2 jobs. I lost one of my jobs. Now, when I lost my other job, it was like the money stopped coming in like it was. So I'm just beginning to build my credit up. Now I have bill collectors sending me final notices, and they're gonna send it to collections. I just got everything off my credit, and now they're threatening to send it back and I'm not able to do certain things. But for me, being an ex-addict, going back to that life, I just don't see it. I'm somewhere else when it comes to that. I'm just trying to stay focused and maintain the things that I have here, because I have a pretty decent life compared to where I came from. I'm talking about homelessness, being in the streets, being on drugs heavy, and to have what I have now, I just don't see going back to that part of the addiction stage. But anyway, the clients that we deal with, they're a little different. They're still using. And when we were in the office, we were able to connect better with the clients and get them off of, not get them off, because we're not allowed to make suggestions. We're just allowed to sort of guide them a little bit and not suggest they get off the drugs, because we have no control of that.
Well, you're doing harm reduction.
Yes. And since I only been back a couple of days, I've been back to work. I've been back in Newark for a couple of days, and from what I see, for the people that were on that are on the drugs and dealing with the COVID, it's like it's business as usual. They're still doing the same things. And what's funny about it is, in Newark, I had one of my clients tell me yesterday about a program that they're doing in Newark. How if you stay in the Holiday Inn for 90 days, and if you it's not quarantine. It's for people dealing with addiction and dealing with COVID as well. But if you stay in there for 90 days, after that 90 days, you're guaranteed to get your TRA. But he said he don't even know if people are really staying, because people still want to come out and do the drugs. You know what I mean? So looking at this from so many different angles, man, those drugs are dangerous. Rosario is deep, and
what would you suggest, to all the counselors that are here and all the people, who might have people in their lives who are struggling with this? I mean, you seem to be very clear about where you stand, and what it is that is inspiring you to stay where you are in the sense of sobriety. Mm-hmm. Where does that strength come from?
It has to be my higher power, Rosario. It has to be, because without him, I don't think I would be where I'm at today. And yeah, that's the bottom line. It's just my higher power. And it's like, really, when I hit that last bottom, I just made a conscious decision that this is not going to happen no more. And this is with cigarettes, alcohol, heroin, cocaine. I used to do all that stuff. I just simply made a decision I didn't want it in my life no more, and that was it.
It's not so clear to a lot of people, right? I mean, and so there are different approaches to think about that. And I see Jeannette, smiling a little bit. So I'm getting to you, my dear. But I want to, just thank Darris again for the very personal connection. And I may be going back to you one more time, because I want to bring everybody, one more time. Okay. But I would like to move to Jeannette and ask her to share with us. You can pick on any one of those issues that have been talked about. But of course, I would like for you to bring in the idea that there are many, many homeless people who may have even less access to many of the services that we are talking about. Clearly, many of them don't even have access to shelter. And how do we as a society can begin to grapple with the idea of helping people who may not even be able to, who don't have a place to go back to after they come to a session with us, or after they leave the 12-step program, and talk about like Zoom and telehealth for people who they may have a phone. Nowadays, you have cell phones. Anyway, I'm going on too much. I want Jeannette to be the one to talk about this.
Hi, my name is Jeannette Ruffins. I work for West End Residences. It's a housing development corp. We do shelter, transitional housing, and permanent housing, all for homeless or formerly homeless persons, right? Now, New York is a little different because we have a right to shelter in New York. So having a right to shelter means that anybody who wants a shelter bed gets a shelter bed. But they're not all private. So we had been moving away from using hotels, which were actually super expensive without great outcomes. But in COVID, people have decided that people really need to be in semi-private or private places. So they actually went back to hotels. For many of the single shelters. Most family shelters are actually already private. Families don't live in congregate settings. So there are so many issues that have come up to me, which is like, as we move to telehealth, which, I was listening to Phil, we actually have gotten much better individual rates. We've had people sign up for individual counseling, but substance abuse really is one of those places where peers and groups, like that kind of cohort of people who have been there, done that, been through it, they can both call you on your stuff and support you through your anxiety. And so that haven't quite gotten there on Zoom. I think that you mentioned kind of at the end of the room, you see people who are struggling and you say, well, let's go out to coffee, because when they leave that 12-step, they're headed someplace. And so 2 or 3 people would just say, you know what, let's just go out and get some coffee. So that doesn't happen on Zoom. And when we were doing, even on individuals, when people come into the site, that at least that is a couple of hours that they're not using. So I'm a harm reduction model, right? So very harm reduction, people can come in. We actually ask people to promise that they won't use before they come to group. So for us, like the morning that they're there could be the only 4 or 5 hours of the day that they're not using. So now that could be 45 minutes. They could be running into the bathroom, turning off their phone, coming back, kind of thing. So there's a whole different dynamic, and I think people are actually using more, even though in some ways I think they're engaging more frequently. I think harm reduction, so first of all, families are stressful, and the assumption that because you have a place and you're with people, sometimes the people who you're with are the people who are stressing you out. There has been an increase, we know, both family violence, and that's child parent, and also interpartner violence, right? And so before that, the abuser, for some children, school is the safest place for them to be. It's 8 hours a day where they are away from their parent, or maybe if you're an adult, your abuser is out of your house for 8 hours, right? So his time at work or her time at work is your safe space, and you don't have that now. Maybe they're working from home and you're all together, so it's super stressful. And I think the rates of kind of the legal use, like you were saying, either abusing prescription drugs or alcohol, people who alcohol was not their drug of choice has become their drug of choice. I think we've seen that. The other thing is, I think there were people who were doing a better job of kind of hiding their addiction, and it ain't hidden no more because you're in the house with people. As a harm reduction agency, we've been really trying to decide, usually our clients, even though their substance use doesn't put them out of program, there wasn't a lot of use on site. I don't know that they trusted that we wouldn't throw them out because they were using in their housing. But now this is where they are. So we actually have more use on site. Use on site still will not get you put out. That's not who we are. It's your behavior under the influence that can get you thrown out. So if you become a really community nuisance, then you can get put out. I think for really street homeless, I think sobriety among street homeless has always been difficult. I don't think that COVID has made that any more difficult, because I think it's I think few people who are using decide while they're on the streets. I mean, it's one of the reasons why we say housing is healthcare. Housing is the first step in recovery, or a stable place to live is the first step in recovery, because it's really kind of hard to think about not drugs and alcohol are a coping mechanism. And so where is my incentive to cope when I am living on the street? So I don't know that a lot of street homeless start recovery while they are street homeless. I think what we have is people who are very new to housing, or maybe it's in shelter, or maybe it is their first new apartment, and they're going to struggle with that recovery because it's so isolating. Now you have a place and you're safe, but there's none of that kind of community that usually embraces you and walks you through it. And I was thinking about 12 steps, for the people who are new in recovery, they often have 2, 3, 4 meetings a day, right? I mean, they're just doing it as an option to something to do and something to stay sober. And some of that is kind of, and the traveling in between is part of it, right? So you're getting on the bus, you're moving around, you're doing something, you're meeting new people. I don't know that people are as comfortable in Zoom meetings. What I've heard is that there are meetings that were kind of standing meetings, the 12 o'clock meeting at St. John's, right? So they're all already a group. I think it's awkward for new people to join the groups. There's not that community. And I don't know that people are being as consistent with it. What else? There was a lot of things. Class differences or about who is labeled as an addict. I think a lot of the reasons why people get labeled as addicts or referred into treatment has to do with the level of connection you have with social services, right? If you are, Lord knows, I have friends who worked on Wall Street, and if they were not Wall Street brokers, they were addicts. They were seriously every day, but they could afford it. It wasn't keeping them from paying their rent. That kind of hyperactivity was seen as a good thing in a Wall Street trader. People didn't seem to realize that they were just edgy and out of control. They could be nasty and snippy, and all those things didn't bring them necessarily to the attention of the same people who, if you are in public service, you would have been fired, referred to EAP or something. So I think there's
Jeannette, you're saying, because I think it's really important what you're saying. So being able to afford your addiction,
keeps you out of a lot.
Whatever that addiction is, it puts you in a category that is of non-addict.
Yes.
Compared to people who cannot necessarily afford their addictions.
Right, because it also makes you vulnerable. You're on the street, maybe picking up, you're in more dangerous places. I have people who, have their drugs brought to their home, just like they bring delivery food.
Grocery.
Yeah. So, I mean, I think there's a big class difference. I also think that when referring to some of the violence that's going on, I mean, obviously I work with LGBT young adults who are often very marginalized and very susceptible to violence, especially street homeless. I also think that a lot of my young adults who participate in survival sex have put themselves in very, very dangerous situations. So we try to get them housed so that they can make better choices and they're not having to both trade sex for shelter or food or whatever. And that, I mean, primarily I started doing that. That was mostly related to HIV, kind of as harm reduction, and shelter for them was basically keeping them from having to make survival choices. But also, I mean, I think there's so many triggers in New York. I'm in New York. I've read the story about the woman who called the police on the guy who was, bird watching.
What are your thoughts about that, Jeannette?
As a service provider, we are very cautious when we call the police. I'm not saying that we've never had to call the police. We've had people who are really out of control, but we always have the staff meet the police, say, this is somebody who's having a psychotic break. We go with them, we stand in front of them. We do everything to keep that from escalating because it's so easy to escalate. And, as a very light-skinned African-American who walks this world with privilege, right? I mean, people don't always think that I'm Black. So, and I'm lucky my son is also light, but anything can become an incident. It has got to be scary. Anything can become an incident. I mean, my young people say the same thing, though. I mean, they say the same thing that, especially my trans clients, they will say that in a heartbeat. Like you just have to be like your most submissive self. And even that doesn't always keep you safe.
So Jeannette, I'm gonna pick up on what you just said, and I'm gonna go back to all my guests. We only have a few minutes to go, and we'll probably go a few moments after 4, if it is okay with people, just in case we have to. But I would like to go back and just ask each one of you to begin to think about it. And I'll go to Lisa, and then I'll go to Phil, and then Cristina, and then Darris. If there is any structural thing that you'd like to share with us, which Jeannette just did, like she made a point that, she brought up this woman in Central Park who basically, saw this guy, and we saw recorded. Nothing is happening, but she has this whole, film going on inside of her head that puts the life of that man in a tremendous amount of risk. So to me, what was happening is that it's this woman using her white woman privilege that she has acquired historically, that anything she says, it will be truth before the black man says. It doesn't matter, what she says is the truth, no matter what the facts actually are. And it is so true that she herself even believes it when she's reporting the thing that's happening, that it isn't necessarily happen, and we all see it. Right. So I wondered if Lisa has a comment about that, not necessarily about this woman. I mean, we don't need to waste our time too much with that. But, any structural piece of this conversation that we are having that may be illuminating for us. And then very quickly, Lisa, and then Phil, and then Cristina, and then Darris. Lisa.
Yes. So when we talk about the ism, racism, classism, and all of the isms that, structurally are in place by that, I think a lot of times we don't have the skills to necessarily deal with what we're going through. And it brings upon a lot of anger, and misdirected anger, is a big piece, and people are not managing conflict, in an effective way. So people are taking things out on other people, based upon the stress, and it's just that it's more acceptable for people to blame the oppressed person. For instance, I know you probably seen where the police put his knee into the guy's neck and killed him. And they're wondering, why isn't these police getting locked up? And he said, I can't breathe, like Eric Garner. I can't breathe. And like people are getting away with things based upon who they are, and it's okay. And all the protesting that's going on, it's like it never stops. The hatred, and like I said, it's just over and over and over again. And like she was just saying about privilege, and when you talk about addiction and the progression of addiction, a lot of times they're not temporarily. Darris was talking about TRA, which is temporarily rental assistance for a person. But you talk about sheltering a person temporarily. If you're not addressing the issue, the problems, they're still going to be homeless. You're not addressing anything to keep them, to have the resources to build them up, for them to be able to take care of themselves, for different things, no access to ID, just all type of things that structurally designed to oppress. So there's many things that you all covered, and you all had a lot of good points, and it's just so challenging for all of us, especially in the health profession, whether it be harm reduction or treatment or prevention. Because when you talk about the decrease in maybe child abuse or neglect, like what's being reported, you have no really statistics there, because a lot of things aren't reported because nobody sees it. you know. And you talk about, on the other hand, you talk about inside of a facility where people are trying to recover, where they're dealing with a lot of, depression and anxiety, but also anger, mad, because they're isolated, they can't go out. They can't go out. And on top of the suffering from the disease of addiction, they want to go. And rate of relapse and progression is, it's just skyrocketing, to a higher level. And it's difficult to be on the other side trying to help people when you have limited, resources to do so.
Lisa, it looks like we probably could use a whole hour just to talk about, a couple of the points you made, but I'm going to give Phil a moment to reflect on these things before we go. The hour, comes and goes, extremely quickly. So if you have a couple of words to say, this is the moment.
Yeah, I think a lot of what we haven't really tapped into is like how the co-occurring disorders overlap as well. Like how if somebody has a co-occurring mental health and a substance use disorder or addiction, it's just difficult to like kind of parse through that and say, is this person taking care of their mental health, and how are they expressing what they are currently experiencing? So when we get into the intersectionalities of identity, like some people may be more vulnerable to some behaviors, but they may not report it for fear of what's going to happen to them or the people that they care about. Like I'll have client sessions and they'll be like, yeah, this person's been putting their hands on me and they've been doing all of these things, but what is it going to look like for me to call the police on my own family? And am I going to get exiled out of the support system I've now gotten access back into, and all of the emotional abuse that people are experiencing? So I think it's just very, very tricky to like articulate all of how vulnerabilities and social identities can impact someone's perception and willingness to actually vocalize what they've been through, what they're experiencing, and what they're willing to accept as well. Of how we talked about the financial constraints of some people that are like struggling with addiction, what behaviors they're willing to accept and what they're going through to obtain the substance that they want to obtain as well. So those are just some like thoughts that I had.
That's
like,
great.
to keep that in mind is like mental health is very prevalent when we have substance use, as well as what people are like getting put into now that behaviors are being put onto vulnerable populations.
Thank you so much. Cristina, you don't have to, time, I don't want to but I want to give you a chance if you want to.
Yeah, I'll try to be brief, but I think that, we have many challenging issues that COVID is sort of highlighting. My worry is a lot of what we've been talking about in terms of what may be happening inside our homes where no one is documenting. So I think sort of if we want to bring it back to some structural issues that haven't yet been mentioned, I would say, I think this is a time where we need to intervene, provide services, but at the same time need to be thinking about how we might incorporate research to learn from this as it, may be going on for several more months in some communities. So I'll keep it.
And monitor our own behaviors, right?
Mm-hmm. Yes. And
Darris, would you like to share a last word with us?
Yes. Just watching what's going on in the world with the George Floyd situation, and me being involved with the Department of Corrections, the police department, the sheriff's department for so many years. That same thing could have happened to me, and it's very it's scary for me as a Black male here, and I don't worry about me because I'm pretty. I know how to. I think I know how to deal with law enforcement. I do what I'm supposed to do. But I have a son that's driving. I have two sons that's driving cars now, and they don't know what I know about the system. They don't. I worry about them. I worry about my nephews. I worry about other people's kids that don't know how to deal with the police force, and that's something that needs to be really discussed, because if the police pull someone over, people think they have rights, but the police think they don't have rights. And it's just, I don't want to take up a whole bunch of time. Just thank you guys for letting me share everything that I was shared. And, you know, I appreciate this meeting, Rogerio.
Well, thank you for sharing with us. But, you know, you're leaving us with a really important thought. The people driving around, whomever they are, people who are living their lives, they feel that they have rights because there are laws around us. So supposedly, purportedly, we all have rights. But those who are choking, kneeling on, killing, they don't think that people have rights. That's just a certain type of person has rights. And I'll go back to, you know, what I said in the beginning. I wonder to what extent, you know, some individuals even perceive their other people as people, right? So it's not even that there is a person that doesn't have rights. It is the feeling or the thought process that doesn't see the next human being as a person. And that's how it gets justified inside of somebody's head. It is 4:05. We have, you know, late today. I try to, you know, be very specific about 4 o'clock, but this is really an interesting conversation. I'm extremely happy to be here. I forgot to say my name in the beginning, but I think everybody here, I took a look at the chat. Everybody knows me. Rogerio Pinto, professor in social work in the school, at the University of Michigan. Very quickly, Phil is one of our former students. He never said that to us. I love to bring alumni to these conversations. I am going to take a pause from this activity. You will be getting emails from me. You know, I may come back in another couple of weeks. I just need at least a week to just, you know, decompress and see, you know, where to take this. I think that these events have been enormously helpful to me as a person, and all the emails and everybody coming and having these conversations has been, you know, phenomenal. So I think it's been working for people as well. I'll be sending an email to everyone asking for ideas and to see how often we should be doing this. But I am so happy that we completed 12 weeks of excellent discussions.
Now,
So
Rogerio, I'm coming in because I know you're going to be so modest, but I just have to thank you for hosting these phenomenal Thursday afternoon conversations, and also to Addie and the Faculty Allies for Diversity. But you make it seem effortless and seamless, and I know it's absolutely not. And it's really been life-sustaining. I've really appreciated the meeting everybody and the generosity of our guests and panelists. It's really been transformative. So I really appreciate you, Rogerio, and also to everyone who shared of their lives and their minds. So thank you. It's meant a lot.
Thank you for
saying that. I don't know if we can clap you. I don't know if we can, but I want to. Thank you.
I'll do to you, but you know,
yeah, there
anyway.
we go.
Anyway, I will be in touch. We will definitely have to do this again. I just need to give myself a week or so to see how to bring this back. It would have to be, I mean, I think we really have a solid understanding of what COVID has been doing to our heads and to the people around us. And so the next version of this has to be much more action oriented, where we do this and end up the session with very specific things that we wish to do. And so I'll be thinking about that with my colleagues. Many of you, please send me ideas if you have them. So anyway, thanks to my guests again. You guys have been phenomenal today, and all of my guests in the past, and some of you today are repeats because you're so fabulous. You know who you are. So yes, thank you so much, and have a beautiful, beautiful end of the week. Try to relax.
Bye.
Bye.